All right. Good morning, sisters and brothers. It's great to be with you. And I just want to acknowledge this moment that we're in. We're really facing two pandemics. One is COVID-19 and the other is one of racial injustice. And, our focus needs to be on both transforming our workplaces so they are safe and just, but also transforming society. And I want to tip my hat to Local 888 and all of the work that you and your members have been doing, and let's keep doing it together. So we're going to talk about union action to get health and safety problems addressed. And I'm going to be covering the following things: some things about health and safety committees, collective bargaining, protected collective concerted action, building effective campaigns for health and safety, some government agencies and what they might be able to do for us, some resources, and then question and answer. I have a bunch of slides. Some of them I'm going to go over quickly. I understand you're going to be getting them and you can spend some more time with them, but I want to hit some of the highlights, but also make sure that we have time for some discussion at the end. First is, let's focus on health and safety committees. There's two basic types of committees. One is a labor management committee where we sit down with management and have a back and forth discussion about problems and hopefully solutions. The other is a local union or unit health and safety committee. That's often the union side of that labor management committee, and we're going to be talking about some specific roles that group can be involved in. And in fact, in general, it's very difficult to have an effective labor management safety and health committee without there being a strong local union safety and health committee. Labor management committees are usually formed via contract language, but they can be formed if the union and management decide they want to have one. What can't happen is management deciding it wants to have one and setting it up. That is actually illegal. So let's start with the Labor Management Committee and what can make them most effective. This is a quote from a government document. It says, "It's easy to have a labor management committee for occupational safety and health. It is extremely difficult to have one that can make major inroads into solving tough, long-standing dangers to worker health and safety." But that's exactly what we need to do. And in this COVID-19 crisis, we need to do this more now than ever. So let me see if I can. So the structure of labor management committees, we want to see that there are at least as many union members as management on these committees. We say that there should be two committee chairs. The union chooses one, management chooses the other. There are situations where the union is chairing, and that is just fine. What should never happen is that management is the chair. Members of management on the committee should be senior enough to make real decisions. Think about it like bargaining. If you're sitting across from low-level people that can't do anything, you're not going to get anywhere. So it's not that we get to pick the members of management any more than they get to pick us, but if they have sitting across from you low-level people who can't make decisions, it's a sign of disrespect. And there's some things that you can do to kick up the volume so that they do put the right people across from you. Lastly, the union members on these committees need to be selected, elected, appointed by the union. Under no circumstances should management be picking the people. And that's actually a provision under the National Labor Relations Act and under Massachusetts labor law, which mirrors the National Labor Relations Act. All right, we're going to talk about some best practices of an effective labor management health and safety committee. One is research, looking at what do we need to know, and especially in our age of COVID-19, there's a lot that we need to understand in order to make sure that our employers are doing the right thing. Review of current hazards and hazardous conditions in the workplace, determining priorities, what needs to be eliminated, reduced, prevented. Review of workplace changes. Is anything changing? We want to look at the health and safety impacts of anything that might change. It might be staffing levels, it might be equipment, whatever it is, it may impact health and safety. We want to know about it and we want to look at it. Investigate accidents, illnesses, incidents, near misses, other adverse events. We want a team to be going out there to be looking at it that must involve the union. Conduct worker and union involved in-depth inspections and audits. This should be something that regularly happens, and the most important thing in those audits is to talk to workers and ask them, you know, about their situations, what they're concerned about, what they think should be done. And lastly is keeping records, tracking progress, and evaluating success. So that's really what meetings should be about. In terms of measuring success, we do this by looking at, you know, how many hazards and hazardous conditions have we been able to identify? Of those, how many have we been able to eliminate? Of the ones that can't be eliminated, how many can be reduced using the hierarchy of controls? And then how many days did it take from when a hazard or hazardous condition was identified and when it got properly addressed? If that is a long period of time, there's some real problems and things need to be addressed so that you can keep moving on and be successful. The hierarchy of controls, I've just shown it here. And I think probably in the MassCOSH workshop, they went over this, but ideally when there's a problem, you wanna eliminate it. If you can't eliminate it, substitute it, you know, get a safer substance to use. Some of the cleaners being used are more toxic. Some are, you know, don't cause asthma, so you wanna look at using the safer substitute. Engineering controls are ways to keep the people away from the hazard. It would be ventilation systems and barriers and things of that nature. Administrative controls would be training and procedures, and then personal protective equipment is both the least effective way to address a hazard, but in some of the situations we're faced with now in COVID-19, some of the most important ways. So we have to make sure it's the right personal protective equipment. And we say change the workplace, not the worker. It's very important that it's the workplace that's getting addressed here. So some of the pitfalls with labor management committees that we've seen over the years, the first is the deep dark hole. It's the committee where you meet, you raise all the important problems and nothing gets done. All right, there are ways that we're going to be talking about how to address that. Another one is the fix-it committee. It's dealing with kind of small fix-it problems rather than the larger issues of staffing and infectious disease and that kind of thing. We think that there should be a good work order system that if there's a problem with a light switch or something like that, a work order will come in, we'll get it done. And really the only time that a labor management committee should be involved in this is if the system of work orders isn't working. Then you have a system failure, the committee can help fix that, but you've got big problems to deal with. Don't become the fix-it committee. Fixes have to happen, but that's not your job. If they're not happening, figure out the system that's broken and how to deal with that. And lastly is an employer-dominated committee. That's where the employer may be picking the people to be on it or asking for volunteers. They're chairing the meeting, they're setting the agenda. Again, that is not going to have the union voice and power that's needed in this dynamic, and it's actually a violation of law. In terms of the structure, think of it this way. In the middle of the picture is the Labor Management Safety and Health Committee. On one side is the management committee, and whether you know it or not, generally management does have a committee where they talk about this, where they plan, where they set their priorities. And then our side is the Union Safety and Health Committee. In order to make an effective labor management committee, we need the union side, this Union Safety and Health Committee, to meet together separately, independently, figure out what do we want, when do we want it, and what are we going to do if we don't get it. And that all happens outside of the labor management meeting. How that happens these days is a little challenging. Sometimes we've gotten it in contract language so that the union side has its own time to meet separately, independently, and prepare for the labor management meetings. Now it could be a Zoom call, it could be a conference call, it could be any number of things, just where the union side is going to get together and figure out what do we need, what are our priorities, and how are we going to get it. So I want to talk a little bit more about that local Union Safety and Health Committee, what it does. It can investigate health and safety committees conditions by talking to its members and communicate with the members and the leadership and develop strategies. Those are, major things that this group can do. It can survey the members about their concerns and symptoms and all of that. It can do hazard mapping, where people actually draw a picture and identify where hazardous exposures are happening. It can investigate problems, again, by talking to members. It can participate in any kind of monitoring or walkthrough that's done by a state or local or federal agency, so that the union voice is there. It can review a lot of information from the employer, logs of injuries and illnesses, any kind of data that the employer has. I'll just mention that all of that is available to the union either through OSHA regulations or through our rights to represent our members on health and safety as a union, and that's under the National Labor Relations Act or the Massachusetts State Labor Commission. We can engage in regular two-way communication with members and leaders. We can be involved in education of our workforce about particular issues and concerns these days. COVID-19 would be right up there. Other specific activities, when we go into the labor management meeting, generally, we shouldn't come in with a list of 100 things that aren't in order. We should come in with the priority issues that we want them to pay attention to at that time. We should not just have what the problem is. We should have figured out what we want them to do about it. Sometimes that's short-term and long-term. And we should also identify if they drag their feet, if they say no, if they're not doing it, we should be talking about what then gets unleashed. And it could be just a sentence in the meeting that says, if this isn't done, we're going to have to take further action, let them figure it out. But there are many things we can do, and I'll get to those kinds of things in a minute. Help develop the strategies for getting those issues addressed. And if we have to do full campaigns, identify who our allies are, other unions, community-based organizations, and that sort of thing. Specifically with COVID-19, we really want to understand our members' experiences with, are they getting the protective equipment? Are the right ventilation and engineering controls in place? What's happening with the testing, the quarantine, the isolation, return to work? Are there problems with sick or family leave pay? Other issues? And out of that, we're going to develop the demands for addressing the problems that we identify. In terms of taking action, we should look at our contract language. Sometimes we have rights to refuse dangerous work or other provisions that can be brought to bear at this time. Group grievances can be important, but understand the grievance procedure is usually slow, and COVID-19 is an imminent danger that can kill immediately. I mean, you can get it and then within days or weeks die or bring it home to a family member. So we're right now looking at things that work very quickly. A group grievance can be very important in setting the stage, but waiting for an arbitration may be a long process. Group grievances appear to have more power, so getting people to sign on and then publicizing that may be very helpful. We talk about instant bargaining to win COVID-19 protections. And by bargaining, it's things that you can do in an action in an instant that gets the attention of management to do something very quickly. In Philadelphia, librarians who felt that their libraries were unsafe and should be shut down, they put together a petition signed by everybody in the community, and within days, library systems got shut down. Transit workers refused to work without proper protections, and by the next day, they got the protections needed. So there are some kinds of things to think about to really get things quickly. And then the demands could include everything from protections against COVID-19, extra paid sick and family leave time, an end to disciplinary attendance policies, or temporary closure of workplaces if that's needed. In terms of building campaigns, this may be exactly what you're going to need to do. And to build an effective and speedy campaign, there are 4 elements you usually have to be involved in. The first is research and information gathering. You want to look at your specific issue and identify the best protective demands, use reliable sources, conduct surveys, first-person accounts, submit information requests. So remember that health and safety is a mandatory subject of bargaining, and they must respond to valid information requests, and identify examples of effective collective actions that you might want to put in place. The second is communicate and involve your members. So at this point, with our physical distancing, collect everyone's phone number, email address, set up phone trees, communications action teams, use social media, listservs, online newsletters, internet communication platforms, and ensure that communication is taking place in the languages and literacy levels of the coworkers, and use this to develop leadership. Third is developing your demands. Use your research and ideas to come up with what do you want and when do you want it, and then you can also identify some secondary or backup demands in case you can't win exactly what you want right away. And the fourth is to identify and exercise leverage. How are you going to get an employer to do what generally they haven't wanted to do? So that's where you make a strategic plan for quickly winning your demands and turn the heat up, thinking in terms of worker involving strategies and escalating tactics, and think about how to use the media, because the media has been very helpful in a lot of campaigns over these last couple months. Also identify allies who can help pressure your employer. So in this case of building your campaign, actions on the ground can include petitions, buttons and sticker days, pop-up actions, marches on the boss, and dirty dozen. I'll talk about that in a minute. Making the case on the streets, doing things outside, rallies with proper physical distancing and informational pickets. This can get increased media attention, could put pressure on the employer to actually address your demands, and with visible support from allies, you can get a large kind of presence and protect from employer retaliation. The dirty dozen is really looking at, let's narrow it down to the 12 places that they need to act on to make this workplace safe from COVID-19 or really anything else, and put those together, involve your members, decide on the 12. You can, put photo albums together, do testimony, and this kind of campaign can call out your key problems, but also make sure that you press the solutions that you want. Broader course of action would be establishing and building networks, building unity around broader demands. For example, we're trying to get in Massachusetts right now an infectious diseases standard, so there may be ways to plug in with that and many other things, and building unity and power for the long haul. In terms of what are our rights and laws, Under the National Labor Relations Act and also the Mass state labor laws, we have the right to what's called concerted action. That's 2 or more working together to improve pay and working conditions. That includes health and safety. The NLRB says if you're fired for doing that, you can file a claim with the NLRB and you can be protected. What I'm going to say is it is a long, slow, and unreliable process. I'd say file cases where they need to be filed, but do other kinds of things in your campaign. Don't just rely on an agency or a law. And you can look at some of the cases that the NLRB has taken up and won with protected concerted action, going to this link that I have here. So who else is out there? We have OSHA, that has largely been missing in action for the private sector. In March, it issued its guidance on preparing workplaces for COVID-19, but said it's advisory in nature, creates no new legal obligations. OSHA does have a general duty clause and some other aspects of standards that could be helpful. It has a very weak right to refuse dangerous work and weak whistleblower protection. OSHA complaints can be a piece of an overall strategy, so consider filing them and using them like a petition, getting a complaint signed by as many workers as possible. You can use this as part of a media strategy, but I'm going to tell you, since this COVID-19 crisis that we've been in, OSHA has issued 1 citation in this country, 1 citation related to the pandemic. So, we're pushing them to do better, but don't rely on OSHA. We also in Massachusetts for the public sector have public sector in Massachusetts under the Department of Labor Standards. I believe they have 4 employees. You can get more information on your rights, under this law, and it's basically OSHA rights. But again, I'm going to say this can be part of your strategy, putting in complaints, but don't stop there. Do all the other kinds of things to turn the heat up. Because this is a crisis situation, we need action quickly. Reopening Massachusetts, we have some safety standards. You can find them on the web, and I have the link there, but I also want to note that MassCOSH did a report card on Governor Baker's reopening plans, and they failed. They're failing to protect workers, so they're not enough. The Office of the Attorney General in Massachusetts has just come out with a report for unsafe working conditions during COVID-19. I gave the link to the form that you can fill out. This is something that we really want to try. It can call out employers who are not protecting and bring in some possible changes or enforcement. We're waiting to see what this will all bring about. I have the fine print here, so you can read this at your leisure, but it does tell you you can file it anonymously. Our recommendation is, if possible, don't file it anonymously, file it as the Union Safety Committee, the Union E-Board, but put it out there. If you're feeling comfortable with that, because again, this can show our strength and get attention to problems that really need to be addressed. And lastly, I have a bunch of resources. Again, you can look at these at your leisure. Some things from a publication and a group called Labor Notes, from MassCOSH, from the National COSH, from SEIU, from others. So here are more resources for some things that are relevant, particularly to COVID-19. And now, questions and comments. And
hey, Nancy, thank you so much. So far, I haven't seen too many questions in the chat, but I have one. When you often say the union, and sometimes people think that they need to, call the Braintree office before they can take action and reach Brenda Rodriguez or Rand Wilson. So I just wanted to, when you say the union, who do you mean by that?
So that's, you'll see in some of my slides, I put union/unit because it's called different things. But generally in a workplace, the section of the union that's there will be making a lot of the investigations and ideas for what needs to happen and plans for addressing it in that group. That is the union in that workplace. So it's the union in that workplace. Different unions for different things have different protocols. Like if you're going to do certain actions, they need some approval at some level. That's internal union politics and procedures, and you guys would be the ones that would say that in most places where you have a large, statewide union with units, the units have the ability to take on their problems and win those problems. And I would assume that we'd be seeing that sort of thing at 888.
Thank you. Yeah. So we do have a question about the right to refuse hazardous work if you're an essential employee. How do you reconcile, the service that you're providing is absolutely essential, and that's the case for so many of our members, and then they're giving you an assignment that's putting you at risk?
Right. So the first thing is to look at your contract language. You may have contract language. Being an essential worker does not mean that you lose all your rights. In fact, you keep every right that you have. So first is looking at your collective bargaining language. Is there something specific on right to refuse? Other things to look at are the kind of thing that I referred to in protected collective activity. I'll give you one example. There were a group of nurses, and I can't remember what state this was in, where they were working on a COVID-19 ward, and management kept the N95s, the protective respirators, under lock and key, and they could only get those when they found the right person that had the key to then assign them. These nurses were not getting what they needed. So what they did at break time is they sat in the break room, and when it came time to end the break and management came and said, your break is over, they said, we'll end our break as soon as we get the equipment we need. Just as soon as we get our N95s, we will be up and out there. And they actually did not get up out of their chairs. And what ended up happening, this is kind of the instant bargaining thing, is management brought them all the N95s and gave the key to the union, and everybody got what they needed. That was, in effect, a right to refuse. It was also a concerted activity. What we are working on in Massachusetts at this moment is trying to get a much stronger, on the state level, right to refuse into an executive order. But in the meantime, you have a lot of things to look at. One of it is there at least one other person that can act with you? And then you have some coverage under either the National Labor Relations Act if you're private sector, or mass labor law if you're public sector.
Terrific. Let us know how we can help on that law. Another question in the chat. I work for a school. Do they need to provide a formal reopening plan with staff and student safety outlined in that plan? And what's the role of workers in crafting it?
So what's happening, as I understand it right now, is that it has not been determined that schools are going to reopen. There's town by town stuff and some things happening at the state level. But I think this is the time in every municipality for every union to get together with all the unions in the schools and put together the plan for how we want to be right there on these committees, not after they make the decisions and have us comment on them, but sitting in the room when they're looking at what needs to happen. For schools, so much needs to happen, everything from what is this ventilation system like? And can we even be in here because of the potential airborne transmission? To if you have people who are 60 or 65 and older, you know, are they going to get, you know, what's the protection? There are so many aspects of this that unless we're sitting at the table, so I think that there are some things happening at the state level that every union should be involved in, but also at the municipal level, at the town and the county level, so that we can sit at the table and not just have to react.
Thank you. A couple of more questions and we're going to get close to wrapping up. We're due to go back into the buildings on July 5th. How do we get them to clean the air vents and ducts that are over our heads?
So if you know that you're going in on a certain date, this is a good time to put in a formal information request. You want to know not only what they have done, when they have done it, but how often are they, you know, you want to know the brand of the filters that they're putting in. You want to know how often they're going to be changed. Who's going to change it? Do they have enough people to do the cleaning? Who's doing the cleaning, and is the staffing sufficient to do it? You know, you want to know everything about everything. So I would start with an information request. And then one, if they're not answering it, that's an unfair labor practice. But two, if you're not getting the answers you need, then you're going to kick it up a notch to what do we got to do in order for them to do what we need to do before July 5th. And that, you know, that's where building your campaign and all of those elements come into play.
Whew. Yes, information requests. And that doesn't, what you outlined is very comprehensive, but the key is to make the ask of those key questions and submit it to management. And you have the right to get a timely answer. What protections are in place for workers of a certain age if you have underlying conditions, if you're, you know, immuno-challenged or, you know, concerned about that? Are there any extra protections for that person?
So you want to look at the Americans with Disabilities Act, and, you know, you have to look at, you know, are you covered under that? But if you are, it may mean that they have to find ways for you to work from home. They have to find a reasonable accommodation, if it can be found, for you to do your work and stay safe. So again, this is an evolving field that we're looking at, you know, what's working and what isn't. But I would always say, look at the laws that are out there, but then look at collective action and power. And I would say, from my many years in health and safety, the biggest problem in health and safety it's not a medical issue or a legal issue or a technical issue, it's a power issue. And the more we can build our power and our voice, the better off we're going to be, and the more protections we're going to have, and the better we are going into the future.
Okay, thank you. Thank you so much, Nancy. Such great information, and thank you all for all the members and staff that are on this training. It's been such a learning process for all of us. This is new territory where a lot of us have never been before. The health and safety was always one of my favorite places to be, because there is so many things that you need to address. But who knows the workplace more than you, the worker, the member? It's your knowledge and your power. So don't be afraid to use it. And again, as Nancy said, the stronger together, get the entire chapter, get the entire workforce to join together on an issue and stand strong with it, and don't compromise, and make sure that you move forward. And I think, you know, that's the most powerful tool we have, is us all together as workers in the workplace, and especially being a union member. So good luck to all. I know there's lots of challenges out there. Be safe and care about your worker as much as you care about yourself. So take care, and thank you, Ren, and again, thank you, Nancy.